The next thing I want to go through is a bunch of policy recommendations, and these may or may not apply to you, so I will try to go quickly through them, and then I will go through some communication recommendations, which pretty much affect everybody. So there are three sort of general areas that I want to suggest for recommendations. The first has to do with actions, then communication, then education. The action recommendations are in three different kinds of categories: protection, care, and inclusion. And you can see from this chart, I've divided them into policymakers, platform owners, civil society members, like us, researchers, and then some questions to guide. So I'm going to leave those for folks to explore on their own, but I will go through some of the questions. When we're talking about protection, some important questions to ask might be, are we meeting young people where they are by following their preferred platforms and behaviors as opposed to just following what we want? The second one is, are we balancing a concern for protecting young people as a vulnerable group with concerns for their individual needs and voices? Under care, we might be asking questions like, who are the most vulnerable among us? And how are we ensuring that we're not endangering them further in our efforts to study them or engage them or enact policies in their name? The second question is, when we encounter admissions or information that worries us, say about political extremism, how, when, and where should we intervene? And there are recommendations above about those issues. With regard to inclusion, the questions I'm raising are, in our policies and communications, are we talking at young people or are we talking with them? The second question is, what steps are we taking now to ensure that young people are ready to lead the next infodemic charge? And you can see there's recommendations in here, and one of them is training up a youth rollout version of the infodemic management training that we're going through right now. With regard to communication, I've put together a chart organized by messages, messengers, and audiences, and it is broken down by who, where, how, when, and questions. And again, let me just jump to the questions for now. With regard to our messages, we want to ask ourselves, have we broken through the optimism bias, which is a term for how young people particularly think the message doesn't quite apply to them? The next question is, if we've done that, have we avoided shame cycle dynamics? Are we sure that our communication doesn't have this sort of inferred you that's being blamed and shamed? The third question is, would someone viewing this message understand why it's appearing at this time and on this platform and in this way? Okay? The days of generic messaging, I guess they're useful if you want to tick off a box, but they don't really do with young people the work of getting through. Under messengers, we might ask, are we signaling that our messengers are genuine and that our messages can be trusted? So are we putting a human face on our institutional messages? And are we meeting young people where they are in their different kinds of communities online by partnering with influencers who have already established trust relationships? The second question is, are we appearing in the right place and at the right time to effectively get our messages across, which is a bit similar to the first question I asked. With regard to audiences, the questions here are, do we understand the main identifications of the cohort that we're trying to reach? If we say, I want to reach young people, that's too big. Young people where? Speaking what language? Of what gender? On what platform? With what with what ideological slant, with what taste practices, uh, what platform trackings techniques are we engaging to better understand our target audiences. And in the policy recommendations, there are discussions by groups like First Draft, who are urging platforms to adopt tracking technologies like YouTube's have, so we can better see where people are pooling. With regard to education, I'm advocating that we expand current notions of health literacy so that they include a conversation about platform cultures and about health, about social media influence ecospheres. And here's the traditional way that this is being handled right now. You've got health literacy in the middle. At the top, you've got media literacy. Then you've got data literacy, digital literacy in yellow. Then you've got information literacy. And you're free to drill down into this chart at your leisure. This is sort of the standard way it's being handled at this moment. And my proposition alters this a bit. You can see here there is an additional layer here. Yes, there's media literacy, but now there is cultural literacy. That's practiced by lots of folks in health informatics, but I would like more cultural literacy about platform behaviors. Then influence literacy would be in green, and digital literacy as before in blue. And again, this is something I'll be expanding on in my own work, and I'd love to talk with folks passionate about education about this, but I will jump off this for now. I do want to move into a discussion of tactics at work, because sometimes seeing something is getting it. To do that, I want to briefly touch on the general strategies that people use to fight information disorder, and I've sort of divided them into institutional responses and social responses. So let's look at social responses first on the left-hand side, because people are most familiar with those. Most of us know what debunking is at this point. We've been playing the fake news game, so many of us know what prebunking is. Info-activism has to do with organized efforts in civil society to push back. Influencing is exactly what it sounds like. It's persuasion at the level of message and messenger. Then in institutional responses, we have education, legislation, platform regulation, and nudging, which is a new development. At the platform level, it usually involves things like pop-ups, as I'll show you in a moment. So this is a chart that you are more than welcome to use in your daily life. I will not drill down on it, but it is available for you. And I'm going to move right to examples within here. So let's start with debunking, because we know this is one we know quite well. So here I'm looking at practices targeting young people. At the top, we see the WHO's TikTok site, which is featuring some face-to-camera conversations. We see the WhatsApp chatbot, which is not only useful because it automates, it's useful because it allows face-saving privacy for young people as they try to figure out information. And then we see MediaWise, which is a partnership between Pointer, an organization like Pointer, and teens on the ground. And that is more likely to be perceived as sort of an effort to talk with rather than at young people. These are some debunking. So those were debunking practices that were pointed at young people, but there's also practices led by young people. The one at the top left is fascinating. It's at the Zatari camp for Syrian refugees in Jordan. There's limited connectivity on the ground, so 50 youth volunteers are using their phone and WhatsApp groups to walk through the camps and share information. There are also global advocacy groups. This one at the bottom left features migrants as messengers who are using sort of YouTube-based blogs. Then there are, and you can see this on the right-hand side, there are groups that are using Zoom and other kinds of live streaming technologies to do sort of town halls, also quite effective. Now let's move to pre-bunking. I don't have to do a lot of this because we've been spending time on these games. So there they are, and I will jump from pre-bunking that targets young people to pre-bunking that's being led by young people. So here's an example on the top left of a Twitch live streamer who is covering, as part of a generalized series on scams, COVID-19 scammers. And this kind of coverage is invaluable, and we should be, forming more partnerships with sort of organic efforts like that. On the left-hand bottom, we see the I Am Not a Virus selfie campaign, which was an informal movement that was spearheaded by students who found themselves targeted by COVID-19 stigmas. The selfie campaign with a sign. The right-hand side, you see a parody image that features typical imagery that shows up in posts made by natural health gurus on Instagram, who have been known to spread misinformation on the platform. And I think of it as a pre-bunking effort because it shows how fake information gains traction through attractive packaging. And you'll note that I've said here, parodies can be powerful instruments, but they can also backfire. As I said before, a recent parody image circulated on Facebook to mock the Peppers Protect Against COVID story wound up being widely circulated on WhatsApp as true information. So in addition to debunking and pre-bunking, there are formal education efforts that are targeted at young people as well. Some of the strongest ones are run by First Draft, who are helping us with our work. I also want to give a shout out to the Countering Misinformation resource pack. You can see that on the right-hand side by UNICEF, which is an unbelievably comprehensive resource, and I encourage everybody to get it immediately. I want to now move to influencing. So here are some practices targeting young people, and I'll get into practices led by them in a moment. So one strategy that more and more governments are doing are paying influencers to deliver messages. That would be on the top image. But you don't have to involve a human. You could create an avatar. This is one of my favorite ones on the bottom left. It is from Thailand, and it is a spokes Shiba who gives health-related messages like stand 3 dogs lengths apart when indoors. There are also a number of campaigns on TikTok that have done quite well. This one is the viral hand washing campaign that was a result of a collaboration between a Vietnamese singer and their National Institute of Health. Now we're going to get to practices led by young people. So again, At the top left, there's something about a selfie, particularly at-work selfies. They are perceived to be more authentic than those that are posed in sort of ideal self shots. When somebody holds a sign in a selfie, they are signaling that they feel themselves to be speaking as part of a larger movement, which can also be a very effective technique. The communications that reference fan communities is what's going on in the middle image. They can tap into this notion of identity through taste performance. The example here features a model wearing a mask that's printed with a tweet made about the K-pop group BTS, whose fans are known as the BTS Army. And the tweet is, for the millionth time, the First Amendment protects you from the government, not from the BTS Army. I'm a BTS fan. The Twitter, what they call Stan Twitter, might be the only effective deployment of messages to young people on Twitter. The final one that I have here is updates from the Nurses of TikTok account. And this one is useful because it focuses directly on location. And that is a very powerful way to get out messages that center on hospitals and other kinds of location-oriented claims that get circulated by conspiracy theorists. These are a couple of examples of nudging that are targeted at young people. We've got YouTube's fact check pop-up that happens, that's on the left I'm talking about, that happens as you're trying to watch a video that has tagged information. There are Snapchat stickers, which are a nice example of building in messages into popular affordances on the platform. And then this other one on the right is an example of a Minecraft COVID creeper. In-game reminders are actually okay with young people because the format of gameplay has built into it a lot of these moments for intervention by the platform itself. Increasingly, platforms like YouTube have this as well. As several people have said to me, I don't understand why I have to watch an advertisement for shoes on YouTube before I get to my fan video, but I'm not watching a public health message. There have been a number of prohibition efforts that have been targeted at young people and their platform use. I've broken this into 3 categories: banning users, banning content, and banning technology. So at the top left, we've got the gaming streamer, I think it's Jair Bolsonaro, who was just kicked off of Twitch for spreading COVID denialism. He is notable for being the son of the current president of Brazil. There is a move on YouTube that just happened to ban health misinformation content relative to COVID. So that would be an example of platform prohibition. And then on TikTok, there have been moves to ban emerging technologies like deepfake technologies that might be deployed by young people to spread information. So last but not in any way least in this quite long conversation are some of my favorite info activism efforts that are being led by young people. You can see at the top, in southern Thailand, youth activists, the Motive, have joined forces with Malay Muslim activists, the Patani, to create short videos that are focused on COVID-19 misinformation and hate speech directed toward Muslims. The effort mobilized various Islamic religious groups, including separatist insurgents, to embrace public health recommendations and more peaceful community relations. So this maps to a recommendation that I made at the policy level to seek out and partner with messengers from ideologically opposing groups to team up with regard to health protection. Beneath this, we have my favorite group in the world, Mafindo from Indonesia. They are young activists who have been at the forefront of hoax busting efforts politically, and now they're moving into COVID-19 hoax busting. And they are maintaining a very robust database of common hoaxes. They are currently partnered with the WHO, and in the perfect world, we get a global dashboard that's full of this information run by activists. The final one, and a very interesting one because they are running surveys as well of young people, is the group of medical students who have joined together in a group called More Viral Than the Virus. And they have also, I believe, partnered with, I want to say UNICEF. Certainly, they must have partnered with WHO, and their work is absolutely worth following. I bet you know of 100 fantastic examples that I have not covered. I'd love to hear them all. So, my friends, that is it from me for now. I am always excited to talk to folks about this and make new connections. Please do feel free to reach out anytime during the training or after. I put my email address here, and I'm really looking forward to working with you over this training session.